Now, I often talk about the parallels between running a dental practice and a restaurant. Today, I'm going to give you some different parallels. It's the parallels between being a good preventative dentist and being a carpenter, actually a roofer. Now, if you have a leaky roof, do you wait until the roof falls down before you replace it? No, because if you did, you'd have to not only replace the roof, but the room below it. You'd have to call the insurance company. You'd have to spend a lot of time out of that room. You'd have carpenters coming and going. It is time consuming. Forget the money. It's just an annoying thing to have to go through. Now, what is also annoying? Going through dentistry. Now, I have 23 crowns. See? I've gone through dentistry my entire life because of a bad accident I had when I was 8 years of age. That's a story from another video. But today, I want to talk about the importance of preventing those problems. Now, we as dentists don't do a lot of prevention. We say that we're preventatively oriented, but most dentists are not preventatively oriented. Most dentists are procedurally oriented. They're looking for the big job, replacing the roof, replacing the second floor of the building. Now, I do that too, but I'd say 90% of what I do, I could have done without any of the treatment that they have to go through if I caught those patients early. If I met a patient at age 22 when they had early gingivitis or early periodontal disease and taught them how to brush, how to floss, informed them of the importance of coming in routinely, then they wouldn't need to go through multiple procedures. Most of the patients I treat either have caries or severe periodontal disease. Now, of course, there's trauma. Those are the three reasons people come to see the dentist, primarily for care. Periodontal disease, dental caries, or trauma. But if I can get to those patients before they develop periodontal disease or they develop caries, I get to prevent a lot of problems. Now, this is something that's sort of interesting. It's almost like when you give to charity. Now, there's a number of ways you can give to charity, probably 7 or 8 different ways. And probably the best way is to give anonymously, and so that the patient or the person that's receiving the gift doesn't even know they got it. When I do scaling and root planing on a young person, maybe 24, 25, put them through oral hygiene instructions, I'm giving them anonymously. Why? Because I'm preventing a lifetime of problems. Now, when I treat someone at age 25, they don't thank me when they're 55 for going through scaling and root planing when they're 25. They don't thank me for the gift that I gave them of teaching oral hygiene instructions and motivating them because they never had the problem. The ones that thank me are the ones that go through $50,000 to $100,000 worth of treatment, 2 years of care, and they finally get their smile back. They go, "Thank you so much, doctor, for treating me," after going through all that. So fixing a leaky roof is sometimes a thankless job. When you fix a leaky roof, you really don't say, "Well, thank God I don't have to replace this roof. Thank God I don't have to go through all that." When I teach people how to brush and floss before they have a big problem, they don't thank me 20 or 30 years later. But I'm putting something good out into the universe. And I think we as dentists should do more of that, and we could do much more prevention. Now, I'm a member of the study club, and I jokingly tell them that most of what we do is useless. And I do believe that, except for the big stuff. Most of the stuff that we do, I believe, is useless as dentists. I said because we don't focus on what's most important. Oral hygiene instructions, scaling and root planing, frequent recall, education, caries control, fluoride, bite guards. How many dentists have a whole preventative program where they go through? Now, I know a lot of you out there go, "No, I do. I have a whole preventative program." But I'm a periodontist. I don't treat caries. I treat periodontal disease. I do implants, bone grafting, soft tissue grafting, and prevention. That's pretty much what I do. I don't do caries, but I have a whole caries protocol that I learned from my friend, Dr. Ziad Jabu. We talk about this program, the Canberra program. I have instructions, I have diet histories, I put them on a very specific protocol to prevent decay if they come in needing that. Most of the colleagues I work with don't have that protocol. I share that with almost all the dentists I work with. But how many dentists out there do a diet history, do a 4-day diet history with all their patients, and put them on fluoride trays if they're prone to caries, and make sure that they do it? Now, that's not to say that patients are going to fill out their diet histories, but it's important that we at least explain to them the importance of decreasing sugar, brushing and flossing after, utilizing fluoride, and some of the other strategies that we use. So I know I'm going on a little bit of a rant here about what we can do, but I see so much damage out there because we don't get the patients earlier. So my rant this week is, let's get the patients earlier. Let's fix the leaky roof. Let's do prevention. They'll thank you, and you'll build a practice of raving fans that are going to be coming in there, giving you 5-star reviews and say, "Thank you so much. I appreciate you doing the right thing for me." They're not going to realize that 30 years they're going to have a healthy mouth because of what you did today. Who can look in the future? Who can realize that? Most people say, what do they say? If I knew I was going to live this long, I would take better care of myself. Well, my average new patient is 65. Most of them did not take very good care of themselves because they didn't know how to. So fix the leaky roofs in your practice. Try to be the gift to your patients. It's a future gift. It's like in Zorba the Greek. Why did Zor plant the tree? He was never going to see that tree grow. He was 70 years old when he was planting the tree, but he's planting it for the future. Save the teeth. He's planting a tree for his grandchildren, his great grandchildren, and all the trees that are out there today weren't planted by me so that I can enjoy them. Somebody else did it. Have a good day, everybody, and remember, be the gift.